It's been interesting having been away from homelessness work for several years and having come back into it, sort of seeing that I'm not sure, when I sort of think about the work that we did on a typology of homelessness, I'm not sure that the best outcome from it would have been permanent supportive housing. That it would have been more like, let's have a nuanced story about, let's think about the needs of homeless clients as people, not let's sort of replace one approach with two approaches. And so I'm sentimentally, deeply, kind of emotionally, I would say, attached to your notion that permanent supportive housing is not the way to go, both because it may not be acceptable, though of course Molly pointed out that in many cases you can get things built, but also because it's not the ideal situation. It feels a little bit like bordering on warehousing people. That being said, the same animus and bias that keep people from accepting a permanent supportive housing project in their neighborhood would also be even deeper if there were efforts to bring individual homeless people with high levels of acuity into neighborhoods overnight on a broad basis. So I think my question is sort of being realistic about the prospects for building permanent supportive housing as well as the prospects for mainstreaming on a broad scale in a very short time. What would you see as a path forward, and how in your day-to-day work, how do you approach this, and how is your organization, the Integrated Recovery Network, pursuing this goal?
Two questions there. Okay, so the way we, the Integrated Recovery Network, are doing it now, we have a contract with the Department of Health Services Housing for Health. It's called the Housing Job Collaborative. People are given housing for 6 months, and our job is to stabilize them so that they can become employed. In this economy, it is easy to get someone a job. Getting them ready to work is the work that we do. And first, I just want to say here, I know your question's about housing, but this is also part of it. Our primary treatment modality is human kindness. People who have been disrespected on the street and in jail, we're trying to change their self-concept so that they can become independent, fully integrated into society. That's our goal for them. So that's preliminary to their long-term housing. And since we see people successfully working, it's still hard, as Molly and I discussed, and we'll keep discussing. We can get someone a job, but because they don't have a background, they don't have a college degree, this is not going to be a high-paying job, they need affordable housing. And that's, as I've said, our biggest problem. It isn't just our problem, it's the problem for the county and the state. What was the second question?
I mean, I think, well, you may have covered both, but okay. It's really, I think you very much expressed how you approach this in Integrated Recovery Network's work. I guess maybe I'll reframe it as, is there something, I don't want to make this too much of a conflict, but is there something that the county or LAHSA, in your mind, could be doing, that if you could wish for, that would sort of reposition their approach to away from PSH towards sort of the vision that you would have, that nobody needs to be in PSH and that everyone should be in the regular housing market, that it just needs to be affordable. Is there something that you would want to see change that would be practical? Okay, I'm going to dodge that bullet for this reason.
MARSHA's not shy about telling us what she thinks we should be doing.
Oh yeah, Molly knows, right? But first of all, let's just recognize all people are different. That means every homeless person is different. And for us to come up with a solution that fits everybody is pretty hard. But we do need to get people off the street as soon as possible. Because as you said, oh boy, people die because it's cold and they have compromised nutritional status. People die because they're murdered. We can't leave them out there. It is too dangerous. So whatever it takes to get them off the street, we have to do. Okay, that's the beginning. Then we can start working with them and get their self-esteem and get their skill sets developed so that they can work. But they have to get off the street to do that, because otherwise they may not live through the experience.
Molly, Marina?
I think the only thing I would add to this bit of the conversation is that I think it may be difficult to cite buildings, and if buildings were our only answer, then I think we wouldn't want to dally and take too much time when there are other solutions possible. I think site-based, project-based, and it's been a while since I've been a case manager, but I continue to hear that project-based does feel like the necessary answer for some. So I echo your statement that it's definitely not for all, but for some. But I think it's also good to remember that in this broad definition of permanent supportive housing, by definition, it's that the subsidy is durable and permanent, and that the tenancy doesn't have strings attached or timelines, and that the services are also durable and permanent to the extent the person wants them. Which means that definition can be applied to tenant-based resources like a Section 8 voucher or a housing choice voucher when the services are added. And that's something we've done recently. We have an MOU with the Housing Authority from the county, and all of their Section 8 vouchers LAHSA administers. We don't have the services, but we partnered with the Department of Health Services, that same type of contract you're referring to, and we said, all right, we have the vouchers, health agency, you have the services, do you want to add those here? And they have those funds complements of Measure H. That results in us saying all of a sudden, wow, we got a haul, we have 700 vouchers that we need to get out there on the streets and get implemented. And honestly, it's hard to move that many housing resources at once, because as much as we desperately need them, it's just, the housing market is tough, and finding, the case managers and the people to mobilize and to make that happen is work. So I think it's just good to consider housing options very broadly when we're thinking about permanent supportive housing, and knowing that, yeah, it's not a one-size-fits-all, but I think there might be a place for the project-based sites as well.
I would say just in a slightly different way, which is that we have a crisis, we need to do everything.
All at once.
Every housing resource is a good thing. We need more supportive housing, we need more rapid rehousing, we need more affordable housing, we need more rent stabilized units. We have to bring on every housing unit possible. And so I try not to sort of say not this one, but let's just do all of it, because the crisis is so bad and everybody is so different that we need such a wide variety of resources that it is all, every resource we bring online, every new housing unit is an incredible positive for the city and the county.
Awesome. We're all in agreement. It's actually, that leads me nicely. I'm going to jump to my third question, actually. But a lot of my work on global health and national crisis and the sort of the path to development has focused on the ways in which crises can focus minds and get everyone to maybe agree to come to the table regardless of what their long-term priorities are, and work together. And so I think it's amazing to see how creative people are being in having all solutions on the table, and it's incredibly exciting. And at the same time, one of the other lessons of this work is that the most successful grand efforts to change a system and change a society are ones that build, they pull off this difficult trick of using an effort to find a solution to a very micro-technical problem as a kind of sneaky way to build solidarity. And the most effective health systems building efforts are ones that can actually build in, that you can use health to help people appreciate that this is what my city or my state or my county or my country does, and we are all in this together. And that those kinds of efforts are most successful when they're backed by a broad level of coordination, yes, but also solidarity, a sort of civic mobilization, right? A Marshall Plan idea. And I'm conscious of the fact that we live in LA and we don't do grand plans. And we're sort of a ways, we were a Thomas Guide city. We're right, if you could just navigate the city. Does anyone remember what a Thomas Guide is? Yeah. And now we're a ways city, right? If it's enough, if you can just figure this city out and navigate it, that's enough. And that and it's a laudable goal, and it feels like that's what the coordinated entry system, that the foundation of our efforts to bring everyone to the table in different sectors, in different segments of the society, NIMBYs, YIMBYs, is all based on a database. And obviously I love databases, but I guess I'm wondering if you all worry that databases or some of the websites that Molly brought up are also sort of technological, low investment solutions. Do you feel like there's a danger that we're not going to do enough to really mobilize this population of this city, the homeless, the precariously housed, and the well-housed, to really care about this problem and to come up with solutions to other problems, not just homelessness?
I mean, I'll just jump in and say, the transformation in the way that we as a community are approaching homelessness from when I started in this field to where we are today are sort of astounding. And everyone says it. I mean, LA used to be the laughingstock of the country in how terribly we were doing on homelessness. We had no unified approach. The providers were fighting against each other. The city and county were fighting against each other. Nobody was working together. It was a serious mess. And it's not to say it's perfect. It is hard working in a community like LA that is so gigantic. We'd be the 5th largest state if we were a state. I mean, we're huge. So it's not that everything's perfect and great, but to see the voters pass Triple H and H, which had 2/3 thresholds that they had to pass. I don't know if you know how hard it is to get 2/3 of voters to vote for something. This is no easy task. I mean, people really came together as a community and asserted our values as Angelenos, that we care about our most vulnerable residents. That is incredible. That is not the LA I moved to. And well, you know, like I said, it's not perfect, and there's many challenges we face, and it's still hard keeping everybody on the same page. I mean, there are thousands and thousands of people who work in homelessness, let alone community members who are interested in this issue. We're obviously not always all going to agree, but I feel like where we are today and what we've been able to achieve, we have cities calling us all the time saying, how did you do it? How did you get your voters to vote to tax themselves to provide homes for the most vulnerable people? When I started in this work, we were working in 2006, we had a measure on the city ballot to do a bond for affordable housing. And at that time, when you were working on affordable housing, all of the pollsters would tell you, you've got to try and present this as something that serves everybody. So you're going to have something for home ownership, you're going to have workforce housing, you're going to have affordable housing, a little bit of housing for homeless people because nobody wants it anywhere near them, so don't emphasize that part of it. You've got to paint it as this thing that's going to serve everyone in the city, and that's the only way for it to pass. Well, that proposition in 2006 did not pass. I think we got 61% of the vote, which is not enough because you need 2/3 to do anything that taxes people. So to go from that to we're going to tax ourselves to serve only the most vulnerable, that was a big shift. And I'm pretty proud of where we are today.
Anyone else want to jump in on that?
I think I would just add that thank you. I think that if the question is, are we doing enough? I think there's always more to do, but I think relative to where we've been, as Molly shared, I think the progress has been so astounding, and so I think there's always more to do, and I think surely the civic engagement, the community engagement, the helping to dispel myths, helping to help others understand what are the drivers into homelessness and how can we as the community be responsive and supportive of this issue. There's always so much work to do, both of the job for the day-to-day as well as with the community. So yes, there's always a lot, there's always more, but I think the progress that's being made as I look back at the last year, some of the work that we've done, working together as a community to sit down representatives from all provider types in the context of leadership from coordinated entry to be able to make decisions and make policies about who would be prioritized. The rubber meets the road when you say we have X number of housing resources and X number of homeless people, who will get them, therefore who will not. And that process took
half of, the whole year to make policies, half of that was devoted to just that question of who will be prioritized. And that's a tense conversation, that's a tough conversation, but to speak to where we have come as a community, to be able to have those hard conversations, to look into data, to have an honest realization that we're already making yes/no decisions, so where are we going to make those? To be able to make those as a community, I think speaks to the fact that we are continuing to learn how to come together to have conversations so we can create solutions together, which for me feels hopeful.
MARSHA, anything to add?
Thank you.
Thank you.
Sure.
I have other questions about how we're going to know that we're actually, that a client has actually been permanently helped, but I'm going to, maybe we can have another panel entirely on measurement and evaluation sometime in the near future. In the meantime, though, I want to turn things over to the audience, and certainly I'd love to hear from you all how you have been inspired by Measure Age and what else you'd like to see to feel more engaged, but also feel free to ask any other questions you would have. We'll start right here. Oh, and right, wait till the mic person.
I'm Dr. Anna Quincy. I'm speaking from the standpoint of the doctor. It's not everybody that is homeless lost their job or a disaster hit. A lot of the problem is people on drugs and mental illness. If you're not thinking about that, you're dealing with just part of the problem. It doesn't matter how much job training you give somebody on cocaine and marijuana and heroin, they're not going to learn the job skills. So while you are trying to find housing, which is what you're doing, which is good, you also need to tie it to drug and mental illness treatment. Otherwise, you're wasting your time.
MARSHA.
I agree. Yes. And so most of the work that we do in our office is to work on mental health and addiction issues. Because success for us is for having someone get the job they want to have. But in order to do that, they have to be stable in themselves and overcome these barriers. And there are now some really excellent treatment modalities that can help people overcome mental disabilities and addiction, get stable, and work the job they choose. It's possible, and we do it every day.
There. Yes, you.
Hello, I'm Jane. I work for a health insurance company, so I wanted to also hear similarly how you guys are working with healthcare systems to ensure that homeless individuals with these mental illnesses and such are getting enough care, and that the two systems are able to kind of connect and make sure that they're continuing the care, if that makes sense. Because for my work, we noticed that it's really hard to keep up with the individuals because we don't know where they are at any given point. And so that makes it hard to outreach to those patients. So.
I can take a stab at responding to that one. So we've been working closely with primarily 2, but now soon all 6 of the managed care organizations in LA County. We already have data sharing agreements worked out with 2, and we're working on figuring out data sharing for the other 4, knowing that we have information that helps them to be able to better identify who that they are serving is actually homeless and how they can bill correctly. We're also working really closely with LA Care as a lead public MCO for LA County regarding plans for the Health Homes program implementation, which, if you're not familiar, is a new program coming online in July of 2019 that provides funding for a number of service types, one of which is housing navigation. That is navigation towards housing that does not actually include the housing resource, but it does include the services to help people experiencing homelessness. And so a lot of our work is looking with them right now is looking at how do we ensure that these services are coordinated, integrated? How do we make sure that that new staffing army of folks has access to the services of the homeless network? How do we make sure that we as in the homeless system are being able to support screening and getting people, if they are eligible for those resources, to a provider who can provide those services? So a lot of these conversations are very present tense, but I think the effort is definitely started. I hope that responds a little bit to the question.
And I'll just respond with one additional thing, which is that one of the amazing things that has happened is the Affordable Care Act. And we went from an environment where very few of our homeless neighbors had health insurance to the vast majority having health insurance, which is amazing. And now I think the real task ahead of us is how do we work on Medicaid regulation so that it supports the work that it takes, the work that MARSHA is talking about, to really help somebody get well. Unfortunately, the way Medicaid is set up is it's not always easy to draw down those dollars to do the work that people really need to get well. So for example, in targeted case management, you're supposed to bill by the minute or track what you do by the minute. And you can imagine if you're tracking what you do by the minute, there's not a lot of time for treatment. So you're spending so much time documenting what you're doing in order to draw down those Medi-Cal, is what we call Medicaid in California, those Medi-Cal dollars, that you're not actually doing the hard work, the case management, the counseling, all of the work that people need. One of the things that's been really helpful for us is we have something called whole person care that's very flexible Medi-Cal dollars through a waiver. And that's been extraordinary, and that's allowed us to do the housing case management that's so critical to getting people well and helping them stabilize in housing. But that's flexible dollars that we only have until December 2020, and then we're supposed to go back to the bill by the minute model, which really hasn't worked for us. So I think we have a lot of work to do in order to change the way Medicaid is structured so that it can really support very vulnerable people in getting what they need.
Fascinating. Way in the back on that side. Uh-oh. We got a coordination issue here.
Shout!
Hi, thank you for coming. I work for Inner City Law Center, who was founded by Nancy Minty, who is a graduate of UCLA Law as well, back in the late 70s. One of the things that I have seen with the last couple of years is this idea of protecting, like, as you were so eloquently saying, to protect the rent control units. As of, let's say, 2018, there were about 750,000 units that were rent controlled, and that number is only going down because we have landlords that are putting the units on they're LSing it, and they're just not putting the effort into. It's just a business, pretty much. And now we tried to pass measure 10, Prop 10, and it was defeated resoundingly. So what is the city, the county, or the city or the office doing? Because Los Angeles is, as we know, is a very friendly to developers. So there's a dichotomy. How can we say that we want to create more affordable housing, but at the same time, we are creating housing that is outside the rent control parameters?
We need people to learn to love rent stabilization. Rent stabilization is wonderful, and unfortunately, it's been really demonized by the real estate industry for a long time, but it's actually a really fantastic policy that's worked really well. What hasn't worked well is Costa-Hawkins, which is the state law that was passed in '95 that very severely limits rent stabilization in California. So rent control is actually illegal in California because of Costa-Hawkins. We are allowed to do rent stabilization, which means when somebody moves out, the unit goes to market rate, but at least when a tenant's in, you can stop the rent increases from being too high. That's rent stabilization. But Costa-Hawkins has had really disastrous effects because one of the things it did that's really awful is it locked in this time frame that said you can't rent stabilize any unit built after 1995. And if you're a city that has rent stabilization, you can't ever amend the date of the units that you're covering. So in the city of LA, it's 1978. We're never allowed to cover a unit built after 1978. One of the things that I experienced at the county, like I said, it was a very, very tough political fight. to pass rent stabilization. One of the toughest political fights I've been a part of. Real estate industry folks really mobilized against us. At one point, they said it was like we were clubbing baby seals. It was really passionate hearing where people were kind of losing. Hundreds of people showed up, which if you go to a Board of Supervisors meeting, the room's normally vacant. But hundreds of people showed up, losing their minds, that we were going to do this. So one of the things I've learned is that we're going to have to approach this incrementally. I was a huge Prop 10 supporter, but Prop 10 was too much, too fast, and that's why it did so poorly. I think that if we approach this more incrementally, if we approach Costa-Hawkins reform as starting with just that issue of the date of the units we could cover, if we could have rolling rent stabilization where we could cover any unit that's over 20 years old. The argument is you don't want to disincentivize new construction by saying new units are going to be covered by rent stabilization. But even if we could just cover everything that was at least 20 years old, that would be huge. I mean, that would bring hundreds of thousands of more units under protection. And one of the things that's really heartbreaking for me is people don't understand that we're in a global housing crisis, and everywhere in America, we're losing our low-income units. The Joint Center for Housing Studies at Harvard every year comes out with this State of Housing in America report that's really fantastic. I highly recommend it. But one of the things they've showed is that everywhere in the country, including Texas, where they don't even have zoning, we're losing our low-income units. Everywhere. They are disappearing because people are coming in, tearing down buildings, building new luxury housing in its place. And nobody builds new units that aren't luxury housing. The economics of housing have really changed over the last 30 years, so that if you're a market rate developer, you can't get financing to do anything that isn't luxury housing. And that's a serious, serious problem for this country, and we have to protect what we have left because it will disappear if we don't protect it. But I do think, sadly, we're going to have to take a little more of an incremental approach than Prop 10 did because the political forces against us are huge and really well funded. They put, I think, $90 million into defeating Prop 10, just to give you a sense of the kind of profits they're trying to protect. It was a lot of money against us. And so we're going to have to do this in a more incremental approach if we want to have success, unfortunately.
Could I just respond to the person who asked the question? What's so important is what you're doing. Because what I have found is that there are people, tenants, with rights, but maybe they're older people, or they aren't English speakers. They don't know how to advocate for themselves. And yes, it's good that you're a lawyer and you can help them, but sometimes it doesn't need a lawsuit. It just needs someone to have an advocacy relationship between the landlord and the tenant to say, wait a minute, let's work this out. We've got rights here. Those rights need to be respected. And not everybody are like the three of us who don't mind speaking in public, who will stand up for anything to anybody at any time. Some people need some help. So what you're doing is really important, and I just say keep doing it and do as well as you can.
Awesome. I think we've actually run out of time, but there will be plenty of time to talk to the speakers and to the other people who are here. This has been just a terrific event for me. I'm especially inspired that all our professional schools are represented and are here talking about these issues. So thank you to those who are from law, from social work, from medicine. And with that, I will hand things over for the final remarks to ALINA DORIAN.
Good evening, everyone. My name is ALINA DORIAN. I am the Associate Dean for Public Health Practice at the Fielding School, as well as one of the session organizers. I really want to thank you all for being here tonight. Thank you so much to the presenters, MARSHA Temple, MARINA GENCHEV, and Molly RYSMAN, mostly for your incredible work, but also for truly inspiring us tonight. Your powerful insight was amazing. Thank you, Dr. Randall KUHN, for all of your help in planning this session and in moderating it. Thank you to my session co-organizers for all of your time and effort. A special thank you to Wendy Levin, who was instrumental in the early planning stages of this session, and to Tabashir Sader Nobari and Elizabeth Antonian for helping us create the video outside that showcased some of our UCLA FSPH work in health and homelessness. I hope you all will join us for our next health forum. It's about gun violence prevention. It's on Wednesday, April 3rd, which is a departure from our usual sort of end of the month slot because we want to hold it in conjunction with Public Health Week. The program will be coming out soon. I also hope that you will join us for our 45th annual Lester Breslow Distinguished Lecture on March 4th at 6 o'clock. Dr. Breslow was a professor, former dean of the school, a pillar of the Fielding School community, beloved by students, alumni, and faculty. The evening's going to begin with a reception and then a special viewing of the Lester Breslow archives. And we're thrilled that Dr. Barbara Ferrer, director of the LA County Department of Public Health, is going to be our distinguished lecturer. The event's free, open to the public, and there's more information in your program handout. And last but not least, we talked about it and you really inspired me. Every single one of us makes the difference. So, supporting and sponsoring the Paul Torrens Health Forum is also one very important way for all of us to do that. The Health Forum is a free community event. It's open to everyone, and it's just like we felt tonight. We saw it and we feel it. Helping it grow helps all of us become empowered and to do more for our community. So I hope you can do that. Giving links are in the program book. Once again, thank you so much for being here. Drive safe. Have a good night.